same as lockdown in some places. And one big difference between countries and their approach to lockdown is how you enforce them. So it's not necessarily how much you lock down, but whether or not there's any teeth in the recommendation. In the US, where personal independence is often prized, lockdown enforcement isn't usually the case, and it relies on people to kind of decide on their own. In many other countries like Melbourne or China, for example, lockdown is, when you make a recommendation on lockdown, you make sure that it gets carried out. It's not just hypothetical and academic.
We heard there are suggestions that in the UK testing people who are asymptomatic, testing the general public. Why is that still not being done in the US, where focus seems to be almost exclusively on vaccines as a solution?
Because right now, Roee, part of it is, I think, there is the golden apple of the vaccine looming in front of folks, and the US hasn't been very good in rolling this out, so there's been a lot of public discourse about some of the perils associated with that. And I think that came at the behest of other public health interventions, including widespread testing. I think contact tracing and testing has probably fallen prey to the big surge in the US, and a lot of personnel are diverted into sort of more emergency measures, like taking care of folks in the hospital or trying to roll out vaccinations without a balanced approach necessarily.
President-elect Joe Biden is calling for the release of all of the vaccine supplies to get into arms ASAP. The premise there is that those people would still be able to get their second dose 3 or 4 weeks later, as the science suggests they should. How is the Biden transition team so certain that the supply will actually be there, and what happens if they're wrong?
I share your concern, Roee, and I think that many scientists do share that concern, that you're banking on the fact that not only will there be a vaccine after you distribute all of the existing vaccine in stores, but that you'd have the same vaccine. And I think that makes a lot of folks nervous. But at the end of the day, we could have 1 billion vaccines available tomorrow. We are only distributing about 30% of the ones that already reached the state level. So it may just be all talk without necessarily having to get there.
And indeed, some states have been slower than others to vaccinate, some using less than 25% of their available supply. Why is that? And are you surprised that after all of the talk about a vaccine, there's been such a slow uptake in some places?
I'm surprised in with some particular areas, and I'm not surprised in other areas. So I think what's not surprising is that public health in the United States has been systematically defunded for many years. And it takes a lot of money to sort of distribute the vaccines, not just develop the vaccine in the lab. And I think this was underestimated. But I think what was not expected was the high rate of early refusal, even in healthcare industries where 30 to 50% or more in some areas of healthcare workers are deferring the vaccine. I think the other aspect is the Byzantine and multi-layered rules. You have to be over 75 and maybe health conditions. I think it's confusing at the next rollout who's going to get it. And then overall, it's the fact that we don't have a national payer for healthcare and a national health information system where it's hard to keep track of people, and people are thought of as being in systems rather as being part of the United States of America.
The World Health Organization says that inequitable vaccine distribution is helping the virus thrive. Can you explain?
Yes, and I thought about this real early on, right from the beginning of the pandemic. The virus doesn't care if you live in the United States or if you live in the Caribbean, where I was born. The virus has no walls, it has no borders, and we hem and haw a lot about vaccination distribution in the US or vaccination distribution in the UK or the EU. But the sad fact is, until you think about vaccine equity and everyone in the world having access to the vaccine, you're not going to have a healthy world economy, because the economy depends on people moving back and forth and goods and services moving back and forth freely. And that's not going to happen unless everyone gets vaccinated.
And we're not hearing a